National Snake Bite Management. As on 18th and 19th we have just done these sessions on snake bite awareness. The 19th is celebrated every year as a snake bite awareness day, and AIMS Bathinda is a regional center for One Health under National Program for Control of Zoonosis, and we have developed a capacity of diagnosing many zoonotic diseases like brucellosis, leptospirosis, scrub typhus, and we are expanding our horizon for detecting many more such diseases. And this is a regional center, so whole Punjab, Haryana and Rajasthan will be covered under this center. So as a part of this, now NCDC has included snake bite management also under this regional center. So earlier in 2009, it was snake bite was included in NTDs. Later it was removed, and again in 2017 again it was included. Now there is a target and of WHO worldwide. There is a target of reducing the death and morbidities due to snake bite by 50%, and India is also abiding to that. So there are 3 phases, and now we are in the last full rollout phase, and under this snake bite is a notifiable disease. Earlier it was not included, now it is included, and all the efforts are made to make this anti-venom available at all healthcare delivery level, that is PHC, CHC, district hospital and at tertiary care hospital, so that we can save life and by providing the anti-snake venom in a timely manner. So basically there are 4 type of snakes or 4 type of venom. One is neurotoxic or neuroparalytic, which causes neuroparalytic effects like cobra or krait. Another is a vasculotoxic or hemotoxic effect, that is due to the Russell viper. Sea snake causes a myotoxic effect in our body, and rattlesnake causes a hemolysis, that is the RBC lysis and edema. So basic 4 type of snake venoms are there. So these are the common snakes which are found in our country. That is common krait, which is found all across India up to Assam, and this common krait causes a neurotoxic effect in our body. Russell viper is hemotoxic and it is found all across Indian subcontinent. Then third one is the raw-scaled viper, which is also again has a hemotoxic venom, which is found across Indian subcontinent except in West Bengal and northeast India. And the fourth is cobra, which is well known, found across Indian subcontinent except northeast India, and it has a neurotoxic venom. So many a times, around 70% time, it even due to the non-venomous snake, sometimes death occurs due to the nervousness, due to the fear of snake bite. So it also depends on the amount of venom injected to a person. Sometimes even a venomous snake also doesn't inject sufficient venom to cause a death. So it depends on the time, and it depends actually on the many factors. So different species have a different type of venom, and it depends on the species of a snake geographical location, habitat, climate, and 3 type of venom, that is neurotoxin causes a nervous system, mainly systemic symptoms of nervous system, and which lead to paralysis, respiratory failure, potentially fatal consequences are there. Another, hemotoxin mainly affect the our CVS, central vascular system, cardiovascular system. It affects the blood and causes coagulopathy, hemorrhage, and tissue damage. And third type is a cytotoxic, which damages the cell and tissues and causes local pain. So the common symptoms include, some are non-specific symptoms related to anxiety, and the other common symptoms include the palpitation, sweating, tachycardia, tachypnea, blood pressure and lowering, cold extremities, dilated pupil. So all these are related to the nervous system, and usually due to lot of anxiety and fear, these symptoms are easily evident. Now, sign and symptom depends on amount of inoculum added by the snake. So if the exposure is much, then amount will be more. It also depends on the site where the bite actually happened. It depends on the age of the patient, weight of the patient, and biochemical variability of the venom. So there are different type of venoms. And it also depends on the person to person, that is the response of a person, the behavior of a person, as well as the body composition, or the actually different people react to different thing. So now we'll cover these main poisons, that is what are the local features and what are the systemic effect. So coming first to the neurotoxic effect. So first we can see the bite of fang marks can easily be seen in a patient. Then there is a acute burning pain at the site or adjacent area. There is a swelling and discoloration, and serous sanguineous discharge from that area. Now there are again the 2 stages, the pre-paralytic stage and paralytic stage. In pre-paralytic stage there is a vomiting, headache, giddiness and weakness. So this stage is important for the identification. If we can identify the type of snake, if a person is having a photograph of a snake, or it is advised not to catch the snake or not to waste the time in catching the snake. So if the specific snake is identified, so we can give a specific antivenom. So in paralytic stage we can see there is ophthalmoplegia, drowsiness, convulsion, bulbar paralysis, and respiratory failure and death. So basically we can divide this symptom into 5 Ds and 2 Ps. 5 Ds, that is dyspnea, dysphonia, dysarthria, diplopia and dysphagia, and 2 Ps, that is ptosis and paralysis. Now coming to the next, vasculotoxic or hemotoxic effect of venom. So local features include rapid swelling at the bite site, and discoloration, blister formation and bleeding from the bite site. So if there is a excessive oozing of blood, then the person has been bitten by the vasculotoxic venom. So systemic effect includes generalized bleeding, that is epistaxis, hemoptysis, hematemesis. So you can see, well appreciate in the picture, that is gum bleeding after the snake bite. There is acute shock, and person ultimately lands up into the renal failure. Then the third type is myotoxic effects, that is local features include local swelling and pain, and systemic feature include myalgia, muscle stiffness, myoglobinuria and renal failure. These are the common manifestations, that is local effects if we cannot identify the type of snake, but these are the common sign and symptoms, that is pain, swelling, bruising and tissue necrosis at the bite site, leading to complications such as compartment syndrome, and later there are chances of secondary infection. And systemic effect include range of symptoms including neurotoxicity, hemotoxicity, cardiovascular instability, coagulopathy, renal impairment and respiratory failure. So these are the certain investigations which are recommended, but there are some very easy investigation which can be done at any site. I'll discuss those investigations also beside these. So prognosis depends on the time of bite, that is how much time has elapsed, and it is recommended that within 2 hours if the antivenom is provided, then it will be very beneficial. It improves the prognosis of a patient. Then activity at the time of bite of a person, first aid action provided, taken since the bite, clinical examination, and this is the 20-minute whole blood coagulation test. So in this test we simply place 2 ml of freshly sampled blood in a glass container, not in a plastic container. Otherwise there are chances of false test positivity. So we have to simply place the 2 ml of freshly sampled blood and leave undisturbed for 20 minutes at ambient temperature till the vessel warms. If the blood is still liquid after 20 minutes, then it is a sign of hyperfibrogenemia, that is it is an incoagulable blood as a result of venom induced consumption of coagulopathy. So in Southeast Asian region, incoagulable blood is diagnostic of viper bite, and it rules out lapid bite. So now coming to the management part. So we can manage the snake bite in 3 ways, that is by providing a local management, specific management and supportive management. So the important and the key messages are by providing a first aid treatment. So it is not recommended to wash the bite site, rather than we have to transport the patient immediately to the hospital by immobilizing the bitten part. So it is not now recommended to apply the ligature. बहुत strict वाला compression नहीं देना, so we have to avoid that. Just wrapping the site and immobilizing the site is important. Then rapid clinical assessment and resuscitation. So ABC management rules we can follow. Detailed clinical assessment and specific diagnosis we have to make. Laboratory test we can do. And the most important thing is providing anti-venom treatment in a timely manner. Then observing the response to anti-venom. So it depends on the bite to bite. So we can categorize the bite in mild, moderate and severe type, and depending on that we can give the amount of anti-venom vials. So deciding whether further doses of anti-venom are needed or not, supportive treatment, treatment of bitten part, follow-up and rehabilitation. So these are the key broad guidelines. Now coming to the snake venom specific treatment, that is there are overt bite and there are occult bite. So in occult bite, if there is a person has not seen the snake and there is no history evident that whether it is a snake bite or not, so chances are there that it is due to the crate bite if we see neurological symptoms. So if neuroparalytic symptoms are there with no local signs, severe abdominal pain and vomiting, so we can give anti-snake venom, atropine, neostigmine and ventilation. So these are recommended for such cases. For asymptomatic bite, if there is only anxiety, palpitation, tachycardia and paresthesia, so we have to observe the patient for 24 hours, and if everything goes well, then we can discharge the patient. Same is in dry bite cases. But if there is a symptoms are developing, so we have to categorize the person on the basis of certain features, like if it is having a progressive painful swelling, then chances of viper bite is there, that is local necrosis, ecchymosis, blistering, painful swelling and compartment syndrome, then we can give anti-snake venom. And if the bite is by cobra, then there are chances of neuroparalytic syndrome, that is again 5 Ds and 2 Ps, that is ptosis, diplopia, dysarthria, dysphonia, dyspnea, dysphagia. So again anti-snake venom, atropine, neostigmine and ventilation we have to give. In case of Russell viper or saw-scaled viper, there is a vasculotoxic symptoms are there. So there is excessive bleeding from the bite site, demonstrable coagulopathy, shock, acute kidney injury. Again we have to give anti-snake venom, supportive treatment, dialysis and blood transfusion is also required in many cases. Due to snake, flat-tailed snake, sea snake, chances of myotoxic symptoms will be noticed, that is muscle ache, muscle swelling, compartment syndrome. So again anti-snake venom, supportive treatment and dialysis will be required. So there is another mnemonic, that is do it right. So right stands for R is reassurance of the patient. So 70% of the snake bite are due to the non-venomous snake. So grossly reassurance is required, and only 50% of bites by venomous species actually we have to envenom, we have to give the anti-snake venom. Other I stands for immobilization. So we have to immobilize the patient, and we have to send the patient to the hospital immediately, and do not waste time in traditional therapies. And then tell the doctor of any systemic symptoms while coming from site where the snake venom, where we have the person who is bitten by the snake, to the physician. So we have to notice what are the symptoms are being developed. So it will help in selecting the what kind of snake anti-snake venom we have to provide to the patient. So certain do's, that is assure the patient, immobilize. Traditional remedies have no proven benefit, and do not attempt to kill or catch the snake. Do not wash wound or interfere with a bite wound. No incision, suction or rubbing. Like we have seen many movies where person try to suck it from the mouth. So those type of practices are actually not required. No ligation is required. No application of ice, massage or any chemical treatment is required. So do not tie with a tourniquet, or it can cause gangrene. So reassure, immobilize, go to hospital and tell to the doctor. So this is how we can immobilize the site. So ligatures may be dangerous. So we can do not put all these dressing in a soft wrapping. So it due to tight ligature, possibility of gangrene is there. So no ligatures are required. And such type of laryngeal mask airway can be used. In such type, there is no need of no laryngoscope is actually needed in such cases. So we can use laryngeal mask airway. So after applying the basic management for in a ABC, that is airway, patency, breathing and all, then we can administer atropine and neostigmine before transferring the patient to the hospital. Then tetanus toxide is required for both venomous and non-venomous snake. And then if there is no symptom in 24 hours, patient can be discharged. So discourage the use of ineffective and potentially harmful drugs like corticosteroid, antihistaminics or heparin. So now specific treatment of anti-snake venom. So what are the indications of anti-snake venom? If there are spontaneous systemic bleeding or the whole blood clotting time is more than 20 minutes, there is a thrombocytopenia or shock or paralysis or acute renal failure, rhabdomyolysis or local swelling and rapid extension of swelling. So in such cases, anti-snake venom should be used promptly. So these are the 4 snakes where anti-snake venom has a definitive role. It was the first anti-snake venom was developed by the Albert Calmette against the Indian cobra, and the primary purpose of anti-snake venom is to neutralize and eliminate the venom's toxic components from victim's bloodstream. So in mild cases only 5 vials or 50 ml is required. In moderate cases 5 to 10 vials, and in severe cases 10 to 20 vials. And addition of additional infusion depends on the response. If person is responding well to the snake venom, and we can add more vials if we see improvement. So anti-snake venom can be administered slowly IV through IV injections or infusion at the rate of 2 ml per minute. So ASV should never be given locally at the site of a snake bite like we do in rabies. So it should not be given locally. So there are different type of anti-snake venom, that is polyvalent, that is covering a broad spectrum of snake venom. If we are not sure that what type of venom is there, so we can use polyvalent. If we are specific, then we can use a monovalent antivenom. If there are chances of confusion, then we can use bivalent. So it depends on the availability. So in healthcare delivery system where we have limited resources, then we can use a polyvalent antivenom. Or it also depends on the region specific. If we have more of vasculotoxic or hemotoxic, then we can keep such type of venoms available. So anti-snake venom sensitivity is now not recommended. Earlier we used to do first anti-snake sensitivity, anti-snake venom sensitivity. Now it is not recommended. There are certain local adverse reaction and due to anti-snake venom, but If we weigh, then we have to save the life, so we can very well address these adverse reaction. So early anaphylactic reaction which were seen within 10 minutes to 3 hours. It includes urticaria, diarrhea, tachycardia, fever and hypotension, and late serum sickness syndrome which develop 1 to 12 days after the snake bite. So it includes fever, nausea, vomiting, diarrhea and arthritis, nephritis and myoglobinuria. So for covering the treatment of early snake venom reaction, we can give adrenaline 0.5 milligram in adult in 1:1000 dilution. Antihistaminics and IV hydrocortisone can be given for treatment of early snake venom reactions. So anti-snake venom, antihistaminics and prednisolone can be used in late anti-snake venom reactions. So there are certain challenges about the availability of these anti-snake venom across our healthcare delivery system. There are certain side effects and even in certain cases we have noticed a resistance, that is development of resistance to anti-venom. So supportive therapy include the certain like for coagulopathy, if not reversed after the snake venom therapy, then fresh frozen plasma has a role, or even the cryoprecipitate can be used, fresh whole blood can be used, or platelet concentrates can be used. For bulbar paralysis or respiratory failure where anti-snake venom is not sufficient, then we have to give a supportive therapy in the form of tracheostomy, endotracheal intubation, or atropine and neostigmine, or the glycopyrrolate in place of atropine before giving neostigmine. Or antibiotic prophylaxis or anti-tetanus serum can also be used for providing the care of bitten part. So finally, conclusion is snake bite pose a significant threat to the human health, requiring prompt and appropriate intervention. The administration of anti-snake venom remains the most effective and life-threatening treatment for envenomation. So timely access to medical care, proper identification of snake species. So all actually clinicians, if there are a very easy sign of identification of snakes, so there are 3-4 cardinal signs, but if we will not get the opportunity of seeing the snake, then we have to depend mainly on the sign and symptoms which are developed after the venom. So public awareness and education is very important, and in recent national guidelines it has been recommended to make public aware of such early measures and do not waste time in tantrics and all. So continued research and development is required. So be confident to manage the snake bite. Most of the snake bites can be managed at primary healthcare levels also. Do not kill time before anti-snake venom administration. So thank you.